So my career goal, I always hope to work in ICU and eventually probably become a CRNA or an NP in the future. Avila helped me set up with this goal because the program have a lot of questions orienting toward critical thinking skills that you need to know not only as a nurse but as future leader. And with their simulation programs, their places for clinical orientation, we were able to do a lot of critical thinking, making decisions on our own to prepare us for the future. There is a moment in clinical that I feel like I made a really good clinical decision for a patient. There are so many examples. I just don't know which one to choose. During my capstone previously, because I remember it the most, I was able to take care of an elder lady, and she had pain every single time she moved. So I just use a lot of therapeutic communication and being very patient with her. Whenever I help feed her or giving her medication, and she was very grateful, and I remember she held my hand and just say thank you for being there. So not a lot of people in my family work in healthcare, and I wanted to be like the first person to be able to work in healthcare, which doesn't sound very nice, but it's just that I started out working as a tech in the hospital because I doesn't know what I want to do. I don't know if I want to become a respiratory therapist. I don't know if I want to become a nurse, if I want to become a physician. But starting as a tech position and was able to work with the nurses and see that how much they care for their patients, how dedicated they are to their job, and how professional they are, allow me to form my decision to become a nurse. It's just very hard to say one particular story because it's a compilation of experiences that I have in the hospitals. And when they make decision to call rapid response to save someone from their episodes of hypoglycemic and things like that, it's just a very rewarding career to start.